Hello everyone, my name is Morgan Grenavd, and today I will be presenting a summary of Sandra Moll's article entitled The Web of Silence, a qualitative case study of early intervention and support for healthcare workers with mental ill health. We will discuss the themes that were brought up regarding barriers that healthcare workers identified to seeking support when suffering from a mental health issue. We will also relate this back to occupational therapists and why we need to pay attention to studies just like this. Let's get started. The rationale behind Moll's study is related to reports of healthcare workers' high stress levels. This high stress in the workplace has two consequences: absenteeism and presenteeism. Absenteeism describes the fact that healthcare workers are more likely to miss work due to illness or disability and tend to be absent for significantly longer periods. Presenteeism explains that high proportions of healthcare workers will continue to work despite having mental health problems. Many healthcare workers are reluctant to address their mental health problems because they are surrounded by secrecy and silence. There is a long lag between the onset of symptoms and seeking treatment, which can result in various consequences. The issues can escalate to a crisis point, which can cause social tension in the workplace and could possibly compromise patient care. Early intervention is key to optimizing treatment and avoiding personal, social, and financial costs. Moll wanted to explore what type of support healthcare workers with mental health issues had in their workplace and discover what barriers and opportunities there are for change. She had two research questions. The first is, what is the experience of healthcare workers who have mental health and/or addictions issues? The second, how is this experience shaped by the social relations of work? The study was conducted in a mental health and addictions treatment facility that employs almost 10,000 workers. The study targeted two different groups. The first group is any employees within the facility that had personally experienced mental health issues. The second group was any employees who had not experienced mental health issues per se, but had been in contact with a coworker that was struggling. There was also a group of 12 stakeholders from across the organization that provided input about strategies to facilitate recruitment, theoretical sampling, data collections, and dissemination of the study findings. The data was collected through the means of interviews and online surveys. 16 interviews were conducted, 8 of which were with employees who had personally experienced mental health issues, and 8 with workplace stakeholders who had interacted with ill coworkers. Through analyzing the interviews and online survey, the researchers recognized that the employees were frustrated and felt concerned that mental health issues were not adequately addressed within their organization. 3 main themes emerged that explain the silence that surrounds mental health issues within the healthcare setting. The first theme is that there's uncertainty in identifying mental health issues. Various participants commented on the difficulty of picking up on subtle changes and knowing when to respond to these changes. Even with appropriate knowledge about mental health issues, there are still non-supportive attitudes and behaviors. Healthcare providers have been criticized for their stigmatizing attitudes towards individuals with mental illness. The second theme that emerged from the study was that there is a reluctance to taking responsibility for either seeking or offering help. There is a societal expectation that healthcare providers are invincible and should be able to cope with stressors. This perspective has led to an attitude of intolerance for healthcare workers who are struggling. There are also social tensions associated with breaking the silence surrounding mental illness. Healthcare workers seem to be fearful of the ill employee's response to raising concerns and how that might affect their working environment. Workers also brought up the issue of their workload demands, which overwhelm them too much to have any energy to look after their colleagues. Some workers are afraid that by taking on the extra responsibility of taking care of colleagues, they might compromise their own mental health. The third theme that emerged is that of organizational structure and policy problems. Although policies are usually designed to be supportive, they are often not viewed as such. Some policies are conflicting because they want you to break the silence, but have strict rules about confidentiality. There are also concerns about the difficulties employees face in being able to access the supports that they need in a timely fashion. Comments were made about the lack of on-site support and coverage for employees who had to take time off for their mental health. This is a diagram from the article that is titled The Web of Silence and Inaction in the Workplace. As you can see, there are many components that lead to silence and inaction when a healthcare worker is experiencing mental health issues. All of these components were mentioned by participants in this study. This demonstrates to me just how hard it must be for an individual suffering from mental illness to speak out about it and seek help. There are 3 examples of exceptions to the typical pattern of silence and inaction that surrounds mental health issues in the healthcare setting. The first example is supportive individuals. Having supportive colleagues, specifically managers or superiors, who are intuitive and compassionate, allowed for workers to feel comfortable discussing their mental health struggles and would encourage them to seek help sooner. The second example is the culture of particular teams who were described as being a unit and being supportive of each other. Having an opportunity to disclose personal information without fear of judgment or retribution is important in the process of proactively seeking and receiving support. The third example is having organizational policies that trigger dialogue and action related to mental health issues. There were comments from various individuals that felt these policies were often stressful, demoralizing, and lacked support for the workers who were struggling. So why does this matter to us as occupational therapists? Being an OT means that you are in a high-demand job that can cause high levels of stress. Even though we have the knowledge about mental health and should not have any negative attitudes towards our colleagues that are suffering, stigma around mental illness still exists within our community. There are occupational therapists dealing with a mental health illness who are afraid to seek help or are unsure about how to do so. This study is important because it allows individuals suffering from a mental illness to realize that they are not alone. It provides organizations with strategies to reduce the stigma and create a supportive environment that is specifically helpful to occupational therapists as healthcare providers. Occupational therapists who are not personally dealing with a mental health issue can use studies such as this one to better understand the silence that surrounds mental illness and to develop methods of assisting colleagues when they are in need of support. We all need to remember that reaching out for help is not a weakness, but is an act of courage. If you offer support to someone when they need it, you will hopefully have someone who will support you when you need it.